Hi, I'm Becky DPT. Today, let's discuss whiplash. Whiplash is when your head or your neck move in one direction and then moves very quickly in the opposite direction. So it could be front to back or it could be side to side. Very commonly, this happens when we are in a car accident. Our neck has been forced in an increased range of motion, so forcefully forward to back or side to side, and it has stretched all of those muscles and those ligaments, also causing that spine to very quickly contract and then extend. So we have damage to the muscles, sometimes to the bone, and sometimes our discs. Sometimes we do not feel the pain immediately, but it may take several hours. We may start with a headache. We may feel tension in one side of our neck. It can sometimes take up to a few days for that to occur. Some of the symptoms that you feel are a headache, neck pain. We can have chest pain or chest tightness, upper back tightness. We can have numbness and tingling down into our arms or a burning sensation. We can also feel weakness. Depending on how severe the injury is, you can also have issues with dizziness, difficulty concentrating, even some vision changes, some hearing changes, and it can also affect your swallow. If you have been in a car accident or some kind of trauma where you have been thrown into whiplash, you should be evaluated and seen by a medical professional. They normally start out with an x-ray. An x-ray does not show if you have whiplash, but it will show if there have been any changes to your cervical spine, and it will show if there is any disc space narrowing, which indicates that you could have a bulging disc or a herniated disc. Once you've been evaluated by your doctor or the emergency room and you know that something very serious isn't going on, it's very important to stay active, keep moving. Try not to perform anything that is going to hurt your neck. Also, try to maintain good posture, so that upright posture and not that forward flex posture like we can do in bed if we're on a device or on a computer. We want to make sure that we maintain that really good posture. Sometimes a good neck support or a back support can be helpful. Ice can be used normally for the first few days or so to help reduce the inflammation. That can be done for 12 to 15 minutes each session, and that can be done a few times per day. Heat can also be used normally a few days after using the ice. Once the inflammation has decreased or resolved, heat can be used a few times per day for 15 to 20 minutes each session. Your doctor can also prescribe you some pain medications, sometimes for the pain, sometimes for the inflammation, or possibly muscle relaxers if you are having trouble with spasms. Chiropractic care can be very helpful following an injury if your body is misaligned following. Massage therapy can be very helpful if you are continuing to have muscle spasms or those trigger points where you get those little knots in your muscle. That blood flow doesn't flow into that area as well, which then decreases the ability to heal. I'm going to offer a few exercises here, but again, this is following seeing your doctor and making sure nothing serious is going on. Our first exercise is chin tucks. So tucking the chin straight back and releasing. When you perform a chin tuck, I like to tell my patients to hold it 3 to 5 seconds, nice and controlled. It's just as if you put your chin on a little table and pull straight back. From our side view, again, just sticking that chin on a little table, pulling in and releasing. And we also want to make sure that when we return, we pull back. We don't want to jut that chin out. We want to stay in that good posture, so we tuck and release. If we see that double chin, we know we're doing it correctly. Another really good stretch is an upper trap stretch. We can take one arm behind, one arm up and over, and we're going to pull to the side that we have hold of. Holding that stretch for 30 to 60 seconds. Then we can go into a levator scapula stretch, where we drop our chin and we give that extra pull. Each of these exercises is their own. Always perform these exercises, these stretches on both sides. Our next stretch is a chest stretch, because if you have had whiplash and you are thrown forward and then backward, a lot of times we get that tension in our upper back and in our chest. So we can take our arms behind, we can place it on a chair, roll those shoulders back, and lean forward into it. Just to show you the side view, chin up, shoulders rolled back, chest is open, 30 to 60 second hold, 3 repetitions. A nice, easy, gentle stretch would be shoulder rolls. Backward shoulder rolls. Forward shoulder rolls. Just to get your body moving again. These can be done 10 to 30 repetitions. Of course, we start with 10 and we build up to that 30. This can be done a couple times per day. You should fully recover within a few days to a few weeks. If you're having ongoing pain, it could mean that a nerve is damaged, or that you would have a possible dislocation, or possibly a fracture wasn't picked up when you initially went in to see the medical professional. You should fully recover within a few days to a few weeks. If you have ongoing pain or ongoing numbness, you should be re-seen by your doctor. This could indicate that you have a possible pinched nerve somewhere, you have a possible dislocation, or sometimes if it is a hairline fracture, sometimes those will not be picked up on an x-ray when you initially are seen. Sometimes it takes a few weeks before that calcium deposit shows that there is some healing going on. If any of these occur, you should be re-seen by your doctor to make sure nothing further is going on. At times, it is possible that it might take a few more weeks, depending on how severe the damage was. Hopefully, this helps your understanding with whiplash. Have a good day.